shoot it right in the bag and it comes in, so they don't have to keep shooting you. They will also, if you haven't already, and you know, your husband may like this, that's kind of fun. You know, they're going to want to shave your vagina. They don't want to go through a hairy mess down there. They just want a baby and a baby's head with hair on it coming out. So if you haven't shaved, have your husband shave you, or the nurse is going to come in and shave you and make sure that area is clean. Then they're going to put a like an iodine all over your pelvic area there, which kills all the germs. It looks like hell. It looks like, you know, you're bleeding to death, but you're not. It's a sterile area. And then they're going to put, you know, a little blanket up so that your vagina's up in the air, but you don't see it, so it doesn't seem as bad as it is. And the nurse is going to start to reach in now for the next, whatever it's going to be, 3 hours, 30 minutes, whatever. And she's going to reach up to where that plug was on the part of that uterus, because that plug now has come loose. The water is broken and that plug is not there anymore. And now the vagina, the uterine is going to open up. And she's going to reach up there with her finger and basically feel, if the baby's low enough, the top of that baby's head. If she can't feel the baby, she can feel how big that hole is. And usually as it gets more and more, the pains are more, you're more in pain and you're suffering, and sometimes you scream. And your husband hopefully will be there holding your hand. And the nurse will finally say, you know, it's at 10 centimeters. The head of a baby, 10 centimeters, so it's time to deliver. So basically, sometimes they have drugs that can speed that delivery up. Sometimes you'll get a spinal, which is a needle in the spine. You don't really feel it because it hurts so damn bad down there anyway, but it does block the pain. The reason they don't want to give that spinal is because it goes into the baby and through the umbilical cord, through your blood system. They'd like to get that baby out clean and no drugs in its system. Now these days the baby will have monitors on the baby. You'll look over and you'll see your heartbeat, and then you'll see the baby's heartbeat. And when you bear down and your uterus is pushing that baby towards the vagina, you will see the baby's heartbeat just go crazy, go crazy. And then when you let up, it'll drop back, it'll drop back. So you know that baby is being traumatized. Now, they have their ways of determining, is everything going to be okay? They've measured that baby's head, your doctor has. They've measured your opening, and it looks like everything is good for a natural birth. You may have medication, you may not. That's totally up to you again. Now, that baby can take just so much on that his or her heart from being pushed on. I forget what the pressure is, but it's unreasonable. It's like 200 pounds per square inch, a uterus pushing the head of a baby down to come out the vagina. Now again, most babies will come head first because they've turned over and their head will come first. That's the proper presentation. Sometimes you get crap. Sometimes that baby doesn't turn over and you've got a foot coming through there. What the doctor will try to do is reach up in there and turn that baby to get the head down. Sometimes it works, sometimes it doesn't. If it doesn't work, it's called a breech birth. Trying to get both of those legs to come through at the same time, and then the head at last is a problem because you're pulling on the baby's body and the head is stuck like it's in a noose. It can be very dangerous. The breech birth can be very, very dangerous. Hopefully the doctor knows that before the baby is born. They'll take pictures and know if that head is down or not. Well, on a normal birth, you'll see that heartbeat of the little baby going up and down, and it'll move closer and closer down, and there's blood. You don't see it because they have the sheet up, but your husband sees it and he goes, holy crap, and he faints, most of them. And basically, you know, the doctor is sitting there to catch the baby, and the nurses are right there, and they will tell you when to push and how long to push because they can feel that head moving, and pretty soon, it's the most amazing thing I've ever seen in my life. I've seen a lot of things, but the birth of a human being is the most amazing thing I've ever seen. How a vagina opens up for the head of a baby and comes down and out is the most astounding thing I have ever seen. And I kept looking at it, and I would look at the doctor, and when I first started having children and witnessing, the doctor looked at me, and he could see the concern on my face. And he says, David, don't worry. the vagina will go back to its original shape. Oh, okay. I thought, oh my gosh, I'll have to, you know, do something different here. That looks really strange. But it's all fit down there to do that. It's below the pelvic bone. The uterus is pushing that baby. It's a tremendously strong muscle, and that baby's head will eventually come out. And many times, the baby will cry. It's not even out all the way. And they have a little tube thing that they get they squeeze the tube and suck out all of the fluid and the water and whatever. So when the baby breathes, it's not bringing in water into its lungs. And then the last 1 or 2 pushes, the little body will come out in its butt and its feet. Well, it's still hooked to the umbilical cord. And so the doctor will clamp it in 2 positions, and then he'll cut it. He'll hand the baby to the baby's doctor, and the nurse will clean it up. When the baby comes out, it looks like hell. It's got white stuff all over it, and it's got, you know, kind of looks like someone threw cement all over it. And the nurse will rub it off and stimulate the baby so it'll cry. And they put it under the French fry lights and clean it, and then pretty soon they bring it over, and the sooner they put it on you, the more bonding that goes on there. And the only thing a baby knows how to do is pee and suck. And if you put that baby right up on your breast, man, it'll grab on. I don't know how they do it, but they do, and they suck. And colostrum will come out first. Your water or your milk will not come in for 2 or 3 days, but they'll suck out colostrum, which is a powerful, powerful antibiotic and healing agent. That baby needs that to survive well. And now the doctor is holding on to the umbilical cord that's still up in your vagina. And basically, the vagina now will become automatic, expelling that placenta. And he'll gently pull on it, and pretty soon your vagina or your uterine wall will let go of it. And he'll pull it out, and it's about that long, and there's like a big piece of steak. It's a big round, it looks like a piece of steak hooked to the umbilical cord. It's called the afterbirth. He throws it away, and then your vagina starts to collapse back to where it belongs, and that baby sucking on a breast, all those muscles in the vagina become tight again. And the more you breastfeed the baby, the quicker you go back into shape. Now let me deviate to what's called an episiotomy. Sometimes when that baby's coming down and it's your first baby, your vagina's tight. It has never had a baby come through it before, and it's coming through the pelvic just fine, but your vagina is not stretched quite far enough. So there's a piece of skin right at the bottom of your vagina. It is the bottom of your vagina, and just between there and the rectum, and the doctor will snip that just a little bit, maybe a ½ an inch, maybe an inch, and the vagina will open up more. Now, there's going to be a little bit of blood there. The baby will come through, and then the doctor will sew that back up. You'll probably not even feel it with catgut, which dissolves, so you don't have to go back and open your legs up and have him cut those stitches. And that's called an episiotomy. And the best thing for an episiotomy is basically sitting in what they call a sitz bath. I think it's S-I-T-Z, which is just kind of water with a chemical in it, maybe a little soda, I can't think of what, a baking soda or whatever, and just sit there, and that area of your body starts to heal very quickly. The stitches fall out, you don't even know what was there, and that's an episiotomy. And I don't know, I'm not a gynecologist, I don't know how often that is performed. Most of the time it's not. Sometimes it is. I wouldn't be surprised if it's 30% that do get an episiotomy, but like I said, you don't know what happened, and you know, the stitches dissolve and it's no big deal. Now here's the other thing that can go sideways. Let's say that you're watching that baby's heart and you're pushing and pushing, that baby's not moving. And you watch that heart, and pretty soon the doctor, with his experience, her experience, can look at that baby and look at the other people in the room, and they're all looking at each other and they're going, the baby's in distress. It needs to be born. It's not going to be born alive if we keep pushing on its head like that. That ain't going to happen. Now it's the decision for a C-section. And they'll tell you, you know, it's not coming down, we're going to do a C-section. Well, there's good and bad to a C-section. The survival rate on babies is outstanding. Babies seldom die in a C-section, and mothers seldom die in a C-section. So they move you out of that room into an operating room, and now the dad has to put on you know, different clothing and sterile gowns if he's going to be there. And they're wheeling you in, and now they've called the anesthesiologist, so you've got 2 doctors. They don't operate on you by themselves. If he has a heart attack and you're wide open, who's going to sew you up? So here goes your insurance bill, okay? You have an anesthesiologist who's there. You're going to have 2 or 3 nurses there, and you're going to have 2 qualified doctors there. And what they're going to do is they're going to put a little sheet up right in front of your face. You ain't going to see nothing except the anesthesiologist over here, and they may have on you a cup for the gas. You can still speak a little bit. They may not have a cup on. He may be going through your veins with an anesthetic. And he will watch you like a hawk. He knows if you're in pain or not. And for God's sake, say something. Go, shoot, oh, ow, ow, ow. And then he'll push his buttons and he'll, oh, better, okay, thanks. So you work with that anesthesiologist because you're not going to see your surgeon and your doctor at all. Well, what they're going to do is, they used to, years ago, they used to cut you straight down, usually at about the hairline of your vagina, where your pubic hair is the bottom of your uterus right there. And they used to cut there straight up, and you had a scar that, you know, was straight down your stomach. Now they have what they call a bikini cut, and that goes across the top of where your pubic hair would be. And it's an incision that's probably whatever, anywhere from 8 to 10 inches to let that baby come through. So they've got to cut through your skin. Yeah, there's going to be some blood there. And yeah, you're not going to feel it because that anesthesiologist has got you no pain, no pain. You keep talking to him and saying, I feel it, I feel it. Now you'll feel the pulling a little bit, but you shouldn't feel pain. If you feel pain, you say something to the anesthesiologist. And so they'll cut that skin layer open, and the doctors many times will work together, and then they're going to cut the uterus open at the bottom. Okay, and Mr. Baby or Miss Baby is going to be right there. They're going to pull the baby out, and then they're going to clamp the umbilical cord again, hand that baby over to its own doctor. So there's 3 doctors in there. There's 2 for you, and 1 for the baby, and 1 or 2 nurses, and an anesthesiologist, okay? And you're in a sterile, expensive operating room. So, now you hear the baby crying, they're taking all of the crusting off of him and her and then trying to make it look cute for you before they bring it over. Because it looks like, you know, I don't know, it doesn't look like a baby to me. But anyway, they clean it up and bring it over, and now the doctors start to work. They'll get the afterbirth out, and they'll check the vagina is not bleeding, or the uterine is not bleeding, uterus is not bleeding. They'll sew the uterus up, and then they'll sew your skin up. And again, they'll use catgut or dissolvable stitches so that you don't have to have them pulled. And basically, the bleeding should stop, especially if they put that baby onto your breast and the baby holds on and starts sucking on the nipple. There's just an automatic response in a woman's body that uterus contracts, you become skinny and young again within a day or 2, and the vagina tightens back up, and you're back. You may be in there 3 days, 2 days, 4 days, depends on how bad the situation was. And in relationships, now you come home. Well, it used to be you and your husband together. Now there's somebody between you. Jenny. And he goes, whoa, wait a minute, I didn't get much sex and didn't have your body at all the last couple of months, and now she has all your body. When do I get it back? Those are problems. Those are relationship problems where husbands and wives need to talk to each other, need to agree. He has to have respect for you and your pain and what you're uncomfortable with. Now, I had 1 or 2 wives, and we went right back to intercourse within 5-6 days of the birth of a baby. Didn't bother her. She didn't care. And I was happy. But there can be relationship problems when that baby is breastfeeding in the middle of the night and you can't snuggle your husband because you're going to suffocate the baby. The baby's crying. You're trying to have, a relationship again sexually. And I'll tell you, as soon as that baby cries in another room, you might as well forget sex. Your wife hears that and her whole body shuts down. She's going to run across the room, grab that baby out of the crib and sit in a rocking chair, and you can sit there, watch TV, and that's going to be about it. So, I'm sure when I review this I've left some things out. But these are the things no one ever told me. I never knew how a vagina worked. I never knew what people did in relationships. And it was all strange to me when I was 19 years old and I got married. Like I said, I've been married 6 times, and I've gone from, you know, youth to old age, and different ladies that have given me the birth of my children. So I want you to, number one, as women, be proud of who you are. Vaginas are not dirty. Vaginas are not mean and cruel. If you've been molested or raped, that was a person that did that to you. That was not a vagina. It just happens that you were wearing a vagina when you were assaulted. It's okay to be excited. It's okay to have your vagina wet. It's okay to be having fun and having excitement of dancing and affection. Affection is the beginning of sexual contact. If it's not supposed to be sexual, the affection should stop before it becomes sexual, because the attention and the affection is the beginning of sexuality. But if it's a dad, or it's a brother, or if it's mom or someone else, they can kiss you and hug you and play with your hair and tickle you and whatever, but there comes a point where that's done. Okay? Anyone that touches you in a private area, and you know what that is. I don't know what it is. Girls have a sixth sense. They know whether you're touching them for medical reasons or emergency reasons, or you're touching them sexually. And if they get touched sexually and they don't approve of it, you're destroying the sexuality of a woman. And that's a terrible responsibility, and I'm one for long prison terms. I'm one for long, long prison terms. If anyone molests a child, boy or a girl, and takes away their childhood and takes away their sexuality, that is destroying a human being. So I hope you learned something. You can always go on the internet and check what I've said. I know that if you're Mormon, you haven't heard all this. I didn't hear any of it before I got married. I ended up in bed in the old Hotel Utah with a virgin wife, and she flopped around on the bed like she was in some kind of a spasm, and all I could do was lay there in bed and wonder, you know, what am I supposed to be doing here? When you're brand new married, you don't know crap. And it takes years to come together as a husband and wife. And if you can come together, that is fabulous. I've been married, well, like I said, 6 times, and with 6 different girls. And I had one wife, and we probably came together maybe 20 times in 9,000 sexual encounters. She and I had 9,000 sexual encounters, and we came together twice. So it's you know, you get better at what you do. David O. McKay, which is long dead, and you're all too young to even know his name. He's a prophet of, well, a false prophet of the Mormon Church. But anyway, David O. McKay said, that which we persist in doing becomes easier. Not that the task itself became easier, but our ability to perform the task becomes better. And that's a good thing for sex. The more you do it, the more you like it, the more you understand it. You've got to understand your own body, you've got to understand your partner's body, and then you have to put the two together. Two together. And if one is coming before the other one, or this doesn't work, or she hurts when you do this, don't do this. If he doesn't like that, don't do that. You have to talk and talk and talk right on through, basically, until you both start screaming with an orgasm. But you've really got to talk and know how that girl wants you to move and how that boy wants you to respond. And you know what? When that bedroom door is closed, that is your business. That is your life. I don't care what your bishop says, your stake president. I don't care what the book said that you read. I don't care about anything but you and your partner. What you want to do and what they want to do is right. If it's strange or weird to other people, so what? If you're enjoying it and it's part of your relationship, that's what you have a license to do. It has to be consensual. you may do things for your partner that you're not crazy about, but you do it. And then they do things, it's a reciprocal, a symbiotic relationship. They do something for you that they're not crazy about, but they do. So work together. And it can be a wonderful lifetime experience right on through death to enjoy affection and to enjoy sexuality. So look on your internet, check, see if what I'm telling you is true, and I hope, I wish I was in a college classroom, but I'm not. And you know, I couldn't have said a lot of things at BYU. I could have never said any of this. So hopefully you've got a new perspective. Learn on your own, be proud that you're a human being. You're going to have a vagina or you're going to have a penis, and you're going to have to live with it. And I hope you enjoy it. Thank you so much.